Let's have a look at an issue that affects us nationally but is a global issue, where the World Health Organization has declared Ebola a global health emergency. Now, the organization says the possible consequences of the spread of the outbreak could be particularly serious and has called for a coordinated international response to stop the spread of Ebola. This, as Uganda this evening announced that a passenger isolated of Ebola fears has tested negative. Wilkista Nyabwa has more.
I am declaring the current outbreak of Ebola virus disease a public health emergency of international concern.
In the face of the declaration terming the Ebola epidemic an international emergency, international organizations and governments are now set to team up, trying to put to an end the deadly outbreak. The World Health Organization has called the epidemic an extraordinary event and warned that it constitutes an international health risk.
The committee's decision was unanimous. Its advice to me acknowledges the serious and unusual nature of the outbreak and the potential for further international spread.
The declaration of an emergency is expected to raise the level of vigilance on the disease.
The declaration of a public health emergency of international concern alerts the world to the need for high vigilance for possible cases of Ebola virus disease, but by no means implies that all countries or even many countries will see Ebola cases.
While Ebola is infectious and highly infectious in certain circumstances, it is an infectious disease which can be contained. Let me underscore that. This is an infectious disease which can be contained.
This coming as a big sigh of relief sweeps through the entire East African region after an isolated passenger in Uganda's Entebbe hospital tested negative for Ebola. The Director General of Health Services at the ministry in Uganda said the patient, who is a Sudanese clinical officer, was identified during a screening exercise on Wednesday at the Entebbe airport, where he had arrived aboard an Ethiopian Airlines flight. The patient had been working with the International Organization for Migrants in South Sudan and was referred to Kampala for treatment after he exhibited symptoms of Hepatitis B. But authorities detained him after screening, saying his symptoms pointed more towards Ebola. The World Health Organization estimates that more than 900 people have died of Ebola in West Africa. The disease has spread from Sierra Leone to Liberia, Guinea, and recently Nigeria. Wilkista Nyabwa, KTN.